Good day, everyone. We'll continue our lectures on diabetes and Ramadan. This is the third lecture. If you remember, if you have watched the video on risk stratification, we classified the risks that a diabetes patient has during Ramadan to low risk, moderate risk, and high risk. So today we'll continue from there. We'll start from interpreting those risk stratification score and the implication. Because when we say low risk, what does it mean, and what does it mean for the patient, right? We'll talk about those. If we say moderate risk, what does it mean for the patient? And if we say high risk, what does it mean for the patient? What decision or what advice are you going to give the patient? What are your recommendations? Now we'll talk about monitoring of blood glucose during Ramadan. So let's go ahead. So for low risk, we said it is a situation where a person living with diabetes has a score of 0 to 3. So 0 to 3 means low risk. And for medical recommendation is that Ramadan fast is probably safe. The reason why the word probably is used is that any diabetes patient observing Ramadan is at risk of 1 or 2 complications. But if you have low risk, then the safety of the patient during Ramadan is fairly okay. And there's need for medical adjustment of the medications that the patient is using. So there is need for medication adjustment to ensure that the patient is not at risk of hypoglycemia during Ramadan fast. There's also need for strict monitoring of blood glucose. We'll discuss that subsequently. So the other recommendation is the religious recommendation. Religious recommendations are based on recommendations made by religious scholars. This was part of the Diabetes and Ramadan study group, where a lot of contributions were made by Islamic religious scholars on the advice given to the patient depending on the risks. So the religious recommendation these recommendations are not made by professionals, but are made by religious scholars, Islamic religious scholars. So the recommendation for patient with low risk, fasting is obligatory. That means that individual should fast, right? But he can decide not to fast. Okay, sorry for that. The advice not to fast is not allowed in this kind of patients with low risk. The advice not to fast is not allowed. So you, as a doctor, if you have a diabetic patient, it's extremely important that you calculate their risks. And if you have calculated that risk and the value is between 0 to 3, you are not allowed to advise the patient not to fast, because the patient should fast. Then if you have a score of 3.5 to 6, that's moderate risk, as you have seen in those ones. So the safety is uncertain. It's not very sure, like if the risk is 0 to 3. There's need for adjustment of medication. Also, strict monitoring of blood glucose is advised. The religious recommendation in this case is that the patient is preferred to fast, so patient can fast unless if the patient has concern about his health, that fasting can bring some challenges, or the patient tried to fast and he could not bear the burden that the fasting puts on his health. That's the only period that the patient might be exempted from fasting. But if the patient opt to fast, then there is need for regular monitoring of blood glucose. Then individuals with points greater than 6, that's high risk. The patient decision to fast is probably unsafe, and the religious recommendation for diabetes patient having points greater than 6 is that they are advised against fasting. So you can see all the wordings here is advised against. It is not wise for any doctor to insist that a patient cannot fast, but your duty is to give an advice. So your duty is mainly advisory. So other contraindications or other possible reasons that a diabetes patient may not fast if he has concurrent kidney disease, severe chronic kidney disease, where they are not on medication and still have recurrent hypoglycemia, then the individual is advised not to fast. Or individual with severe chronic liver disease and diabetes who are already at risk of hypoglycemia because the liver is diseased, so the process of glycogenolysis and gluconeogenesis is tempered with, that individual also can be advised not to fast. Patient with severe peptic ulcer disease, where a patient is having severe pain that is not readily controlled, or patient having bleeding PUD, that patient is advised not to fast. Or patient with end-stage tumor, people with malignant disseminated malignancy, then that individual is at risk of also hypoglycemia and other complications if they decide to fast. So for the monitoring of the blood glucose, this is extremely important. It is advised that every diabetes patient that wants to fast should have a glucometer. It's extremely important, because if you do not have glucometer, you cannot make certain decisions at the time that you should. So checking the blood glucose is extremely important for a diabetes patient to always check his blood glucose and make that decision based on the value he has. So what are the times that the diabetes patient should check his blood glucose? First is pre-dawn meal. That's so before suhoor, a diabetes patient should check his blood glucose so that you know where you're starting from, because it is important, as we will see it when we're discussing the diet during Ramadan, that a diabetes patient should not skip suhoor. So it is very important to check the blood glucose before suhoor to know how you're starting the fast. So in the morning you also check. So checking in the morning, let's say around 7 or 8, is telling you how the blood glucose is after what you ate during suhoor. This will give you an idea if what you ate during suhoor is according to the advice of your endocrinologist or diabetes dietitian or not. You can also check at midday. The midday will tell you how the fasting is going, how your blood glucose is going. Is it going towards the low side or not? Then mid-afternoon. So mid-afternoon actually is the period in which most diabetic patients tend to develop hypoglycemia, because at that time, around 3 or 4, is at that time the individuals tend to develop hypoglycemia, especially diabetes patients. As I said in the first lecture, that they have low amount of glycogen store, so they are prone to hypoglycemia. So, and in the previous lecture, we discussed the indication in which a diabetes patient may break the fast in case of hypoglycemia. So, at iftar, before iftar, you check the blood glucose, and 2 hours after iftar, you check. The reason being, you want to know the blood glucose 2 hours after iftar, which will give you an idea the kind of, if you're adhering to dietary advice in terms of what you eat at iftar, because most people, this is the point of challenge. They tend to eat a lot during that period, and also not only a lot, but also food that are very high in glycemic index. So we'll discuss that during discussion of diet during Ramadan. And anytime the patient feels symptoms of hypoglycemia, such as excessive sweating, tremor, palpitation, hunger pangs, and other things, you should quickly check the blood glucose. If the blood glucose is less than 3.9, the patient is advised to break that fast. So this is our discussion on the interpretation of the risk stratification and monitoring of the blood glucose. Watch out for the next part where we will discuss the dietary management or the dietary advice during Ramadan fast. See you there.